Millions of Americans could be losing Medicaid coverage this spring as a process that was put on hold during the pandemic is set to resume. But could you lose coverage even if you qualify? Wake Up Show's Meghan Bragg verifies.
According to Health and Human Services, 15 million Americans are expected to lose Medicaid coverage starting in April. This is because many won't be eligible for the program. But could you still lose Medicaid coverage even if you do qualify? Let's verify. Our sources, the Department of Health and Human Services, North Carolina Health and Human Services, and Lois Norris, health policy analyst for healthinsurance.org. According to NCDHHS, around 300,000 people in North Carolina could be on track to lose their Medicaid coverage. But why? Before COVID-19, people who were using Medicaid had to be recertified every year with information on family size and income to see if they could continue with the coverage. In 2020, states were prohibited from cutting people off from Medicaid because of the COVID public health crisis. But Congress recently passed a more than 4,000-page, $1.7 trillion bill that funds the federal government, and tucked in it is a provision that would eliminate Medicaid coverage protections from the ongoing public health emergency declaration. To stay on Medicaid, families would have to meet certain requirements in North Carolina. For example, those families must be low income and have no other source of health insurance. However, DHHS estimates 6.8 million people will still lose Medicaid coverage even if they remain eligible for the program. This may be because they don't receive the renewal notice, can't provide documentation required by the state, or don't submit documents by the deadline.
If you ignore your renewal packet from Medicaid, you get disenrolled. And so if they can't automatically renew you just based on, information they already have on file.
So we can verify that, yes, you can still lose Medicaid coverage even if you qualified, because now states must once again review Medicaid eligibility every year. With your Verify, I'm Meghan Bragg.